So you tried therapy and you had a bad experience. You're no better off than when you began and referenced the presenting problem. You spent some money unnecessarily, and perhaps worse than this, you invested a fair amount of your valuable time with nothing to show for it but frustration. Where do you go from here? It's a great question, pretty common experience. In the next 10 minutes or so, I hope to help you figure out what went wrong and what your next move might be. So let's get into it. Welcome back to the ACS Mental Health Counseling YouTube channel. My name is Adam Schwartz, and I am a licensed mental health counselor in New York. I specialize in anxiety disorders, men's issues, and relationship coaching. If you find this video useful, feel free to like, share, and comment. In fact, it'd be appreciated. It certainly helps. Unfortunately, it is an increasingly common experience to try psychotherapy of some sort and to either find it completely unhelpful, actively frustrating, or some combination of the two. Maybe you didn't give it enough of a chance. Maybe you didn't mesh well with the clinician. Maybe you weren't actively involved in the process. Maybe the clinician just wasn't very good. Maybe the presenting problem wasn't a good one for therapy. There are multiple possible reasons why it wasn't helpful, and we need to figure out which one of these is most applicable in your case. So, the first thing to understand about the therapeutic process is this. Therapy, while ideally based on science and evidence, is much more of an art than a science in practice. Your average clinician knows very little about research methodology or the scientific method broadly. Believe me, I talk to these folks. If it was purely science, then most issues, most of the time, would be treated in a straightforward way with some sort of treatment algorithm. So by analogy, think of something like a bacterial infection. If you have a straightforward issue like this, then going to pretty much any medical provider will yield about the same outcome. For this analogy, let's pretend there are no scary methicillin-resistant bacterial strains and that these issues are mostly still treated with relative ease. Sometimes they are, but sometimes they're not. All you'll need in this case will likely be is a diagnosis, a prescription, and then your own follow-through on the dosing. One clinician is about as good as the next, and there won't be much variance in the outcome most of the time. Now consider by contrast how much less straightforward the therapeutic process is. So it deals with very inexact starting information, coming almost entirely from a definitionally biased source, which is to say the client, and then seeks to solve problems and dilemmas that are nuanced and at their core really more philosophical than scientific. These problems rather often involve other people, and they have their own inherent unpredictability, and they often involve dealing with a chaotic universe. And even when the clinician has an accurate sense of the problem and a viable solution to it, it is still then entirely on the client to accept, implement, and follow through on the proposed solution or solutions. So think about it. This is a much more complicated process than most other healthcare endeavors, and unfortunately, it's far from scientific. Given these realities, not all clinicians will be equally effective with all clients. There are a number of factors that we're going to have to consider in reference to good clinical fit. First is this one. How good is your clinician generally? Don't make the mistake of thinking that everyone who went to a relatively non-rigorous therapist education program and then successfully passed a multiple choice licensing exam, two of the prerequisites to practice, is going to be equally good at psychotherapy. Clearly, this is not going to be the case. You have clinicians with varying levels of intelligence, skill, clinical training, toolkits, strengths and weaknesses, all trying to address a wide variety of issues and client types. Make sure to find a seemingly smart clinician with expertise in your area of concern who is trained in the most efficacious and modern interventions for the issue. Without these things, it will be not only an uphill process, but an unnecessarily steep uphill process. We don't want it to be unnecessarily steep. Next, what was your rapport like with the clinician? Did you like them? Did you have similar worldviews? Did you admire how they presented themselves in the world and the life they seemed to be living? These might not seem like factors that are important, but they can be. It's hard to be motivated to take advice on difficult matters from someone that you just don't like that much. And this is the main reason why clinicians will sometimes share a bit of themselves and briefly discuss topics that aren't immediately relevant to your mental health, like their pets or hobbies. We actually know as clinicians that some level of personal rapport and relationship building is important for your follow through on our advice. Additionally, a clinician who has a radically different worldview than you, whether religiously, politically, philosophically, and who unnecessarily pushes this worldview on you, will interfere in rapport, and you should be attentive to this. A clinician who pushes a worldview on you that has nothing to do with the issues at hand and with your mental health goals is behaving somewhat unprofessionally and could be interfering in your therapeutic process. Next factor. Did you give the clinician a chance? A therapeutic process can be a somewhat slow one, as most clinicians are going to reserve judgment and even advice for a bit as they get to know you and your problems. You should actually be wary of clinicians that will give very certain feedback and advice on very consequential matters too early in the process. Remember, while you know your issues intimately at the start of the process, we do not. We are just stepping into your world and just getting to know the lay of the land. Additionally, what was your follow through like in the process? Think about it. A good clinician will give you small behavioral experiments or homework assignments from session to session. They will ask you to implement strategies, habits, changes, and then to notice the effect so that you can regroup and adjust the strategies from session to session. Now, if you do not follow through on these requests, then very little is happening aside from the rather expensive weekly conversation. Now, that's actually not on your clinician, that is on you. I tell my clients all the time that the number one predictor of their therapeutic success is their own proactive follow through outside of the session. Think of it this way. A therapist is like a coach, and just as a coach cannot play the game for you, a therapist cannot live your life for you. And it's as it should be, as no one ever became self-sufficient by having their problems solved by somebody else. So finally, there's a possibility that the issue actually wasn't just a great one for psychotherapy to begin with. It's kind of rare, but it happens. Maybe the issue was primarily medical, such as a hormonal imbalance, a vitamin deficiency, or sleep apnea interfering in sleep hygiene. Maybe you're experiencing a normative amount of transient stress that would resolve on its own. Maybe life just kind of stinks sometimes and you overreacted. Maybe you just needed to cut some stressful people out of your life or change jobs. Maybe you are currently dead set against the change that you need to make, and Carl Jung himself couldn't motivate you to actually make the change before you are ready. People get involved in therapy sometimes without fully considering the nature of the problem, their own motivation for change, and what is actually a normative amount of human emotional difficulty. Now, that being said, if you think you need therapy, pursue a consultation. I'm not trying to minimize anyone's problems, of course. So, summing up, what are our conclusions on this matter generally? Why did you have a therapeutic experience that wasn't terribly useful? In all likelihood, you either had a poor clinician, a clinician with which you did not mesh, or you weren't open to following through on the recommendations from session to session for whatever reason, and this can be understandable. If your issue has persisted and you still think you need more help, this is where do you go from here? Spend some time looking at which reason seems most applicable and consider trying again if appropriate. You need to really look at the professional profiles of the next potential clinician in a discriminating way. Read the clinician's website with a careful eye. Does this person seem bright and knowledgeable? Do they specialize in the relevant issue? Are they trained in the methodology that you most need? Maybe get 3 to 5 possibilities. Reach out to each and speak to each one. Clinicians almost always offer free phone consultations, and this is for the clinician to decide if you'll be a good fit for their practice, but also for you to decide if you'd like to work with the clinician. Don't commit until you've spoken to each. Then make a choice and proceed with the clinician that checks as many of your boxes as possible. Then make sure that you are proactive with their recommendations. That's important, assuming that the recommendations aren't absurd. And if they are absurd, you need to be straightforward in that assessment with the clinician so that you can discuss this and get on the same page. And if you cannot get on the same page, try someone else. It's frustrating, but way less frustrating than continuing to work with a clinician that is not a good fit for you. Okay, that is all for today. I'll see you in the next video. All the best.